Okay, we have these two ultrasound machines at our setup in our operation theater. This is the older one, as you can see. This one is the new and with some advanced and sophisticated features in it. So let me show you a few things that are common in the both of these. First of all, this is the switch on off, as you can see over here, right? So, and over here this is probe. Now you have to select the probe. We have three probes here. We have high frequency linear probe, we have the phase array probe that is also known as cardiac probe, and then we have this curvilinear probe. Same goes here, we have a curvilinear probe here, and with the big footprint we have a high frequency linear probe. Every ultrasound machine have different knobs and keys to select the probe. So this is our machine is of Hitachi, and you can see there is a knob here or a key here. We will press it, the probe. Now there will appear different options to select a different kind of probes. First of all, let me move my cursor over here. This one is for the deeper structures. This probe selection is for deeper structures. Okay, now this one is for the superficial structures. We use this one for not only for the venous cannulations but also for the superficial superficial structures like brachial plexus block, for median, for the wrist and other structures. Adult cardiology, this one over here, we use this probe for cardiac imaging, like in our ICU. Okay, so this is our linear probe. As you can see, it has a flat footprint as compared to curvilinear, and also as you can see on the screen there is a flat rectangular image that has been appearing on the screen. So that confirms that you have selected the right probe. So this probe we use it for the superficial structures. Let's say you have to pass internal jugular venous catheter, so you can use this, and especially you can use it for brachial plexus block. Now I have placed my linear probe on the internal jugular vein and carotid artery. So I have placed it on the neck of my subject, my patient. So you can see I am just moving my probe. Now we can also use this to locate the superficial structures in the wrist. So I am moving my probe down towards the hand to keep an eye on the median nerve. There it goes, there it goes, there it goes, there it goes, and here it is. So you can use this probe for the superficial structures, as you can see, like in the wrist, on the neck. Now we are using linear probe to reach for the QL block, but for that you need a lot of depth. But while using linear probe, we will not be able to reach that much depth. So what we can do here, we can increase the depth. Let me show you what happens when we increase the depth while using linear probe. Now while increasing the depth, still we are unable to reach the transverse process. You can see the image has been squeezed and it's very narrow strip is visible, not the whole of the screen. So the use of the linear probe for deeper structures is not recommended. Now for the deeper structures, we will be using this is the curvilinear probe. So you can see it has a convex face over here. Now if you look at the screen, so we will get a fan shaped, broader and wider image that shows that the curvilinear probe has been selected. So you can visualize deeper structures with this, but the resolution will be compromised. Now we are going for the QL sononatomy, QL block sononatomy. So now over here, this is the body of the vertebra and this is the transverse process. So over here lies the lumbar plexus, and this is the QL, quadratus lumborum. This is the source just in front of the transverse process, and on the back side of it there will be erector spinae muscle. This moving structure, this is kidney coming from this side. For the deeper images, we have to use the curvilinear probe, because as I have already demonstrated to you that this image was almost impossible to attain while using the linear probe. Okay, now while keeping my probe over here, let me show you what is the gain and how the TGC works. By adjusting the gain, you can control the overall brightness of your structure of the image. TGC, the time gain compensation, so it helps you brighten the parts of your image at different desired depths. Now let me show you how it works. These are the time gain compensation knobs. These are used for the top part of the image, these are for the mid part of the image, and these are for the lower part of the bottom part of your image, to make them more brighter or darker as per your requirement. So TGC knobs and keys are used to adjust the brightness of your image at different levels of depth as per your own requirement. So let me show you. So right now all of these are in the mid. I will move one knob at a time, and you will see the changes of the gain or the brightness on the screen. So let me show you here. Now I'm moving one knob at a time, and you will see the changes on the brightness of the can you see? Now the image has been started getting brighter from top to the mid to the lower part. See, now I want it to be more dark on the upper part, so I will turn it on the opposite direction. See, now the image has been getting darker on the top, now in the mid, and now in the lower part. So you can adjust the brightness as per your requirement at different levels. That is the difference between TGC and the overall gain. Now there is a knob here that is used to adjust the gain. Let me show you. Now this knob here is used to control the overall gain. Now I will turn it clockwise, anti-clockwise, and you will see the change in the overall brightness of the whole image on the screen. So let me show you. Now I'm going to turn it, and you will see the whole image has turned bright from top to bottom throughout its whole depth. Now I will turn it to the other side, and you will see, you can appreciate that the whole image has turned darker from top to the bottom of the screen. So that is the difference between the gain and the TGC. Okay, now about modern ultrasound machines, another feature, that is the color flow. When you are in doubt that the structure you are visualizing on the screen is vascular or non-vascular structure, and you are not sure, you can use a color flow. So there is a knob over here. Let me show you this CF. So I will press this, and then you will see a box will appear. This one. First of all, I thought that this structure over here, this one, I thought that this is some vascular structure. So I use the color flow option, and so just to make sure that this is not some vascular structure, neither this one is a vascular structure. So now I will move my probe over here on the other side, and yes, now these two structures are vascular structures. This and this is vein, jugular vein, and this is carotid artery. So one thing to be clarified here about the color appearance of these two structures. So do not get deceived by the color. Don't think that the red color indicates an artery or the blue color indicates a vein. No, it's not like that. These color actually shows that the direction of flow of blood away or towards the transducers. Colors here are just, these color appearing here are just to identify that it's a vascular structure or not. It cannot differentiate between that it's an artery or a vein.